You heard the governor just say that there are 4,358 hospitalizations that were announced today. I want to put that in perspective. On September 23rd, 2 months ago, there were 600 hospitalizations. So we've gone from 600 to over 4,000 in 60 days. So regardless of our ability to test, which has gone up substantially, about 70 or 80% since that time, we have significantly outstripped that number in terms of the number of people actually being affected. I did a zone call at noon today. We're talking to all the leaders of the hospitals throughout the northern zone. All of us are starting to be stretched. We are trying to balance load as best we can. We're transferring within the systems. So whether that's in Cleveland, whether that's the Cleveland Clinic system or university hospitals or Metro, the same is true for the SUMA systems and the Mercy systems, et cetera. But now we're starting to transfer between systems to balance load as well. In addition, what we've seen just in the last few days for the first time on Friday, Governor, we saw for the first time that we were starting to transfer ventilators and high flow oxygen equipment because people were actually running out. My biggest concern today is one I'd like to share with the people who are on the Zoom, and that is that the Cleveland Clinic system alone today, and this was echoed in the other systems, we have 970 caregivers out. And they're out because they're either on quarantine or they have active COVID infection. I want to emphasize that we look at each of these infections and they're not catching it in the hospital. Our caregivers are getting COVID and acquiring it in the community. And they parallel the community spread. So as the community rates of positivity has gone up, the number of caregivers who've gotten COVID have gone up exactly the same way within the Cleveland Clinic system. When you have 970 caregivers plus who are out, that means it's starting to affect our ability to care for patients. What we do to accommodate that is we start closing down some services. So we started a couple of weeks ago about inpatient elective surgeries, and we took those patients who would have been doing those caregivers, who would have been doing those procedures, and we put them back in the hospital floors and in the ICUs to take care of people. We also started coalescing our ambulatory surgery centers. They became busier, but we took those folks, and we put them back into inpatient care. So our urge is that we need your help in terms of trying to prevent our caregivers from being sick and being off work. We need everybody to mask, do social distancing, particularly during the upcoming holidays, and observe hand hygiene. And Governor, with that, I'll turn it back to you.